Bismillahirrahmanirrahim. In our previous session, we had touched upon the terms of reproductive health and maternal and child health, as well as safe motherhood. We had discussed about the initiative of safe motherhood, how it was launched in 1987 under the umbrella of World Health Organization, and almost all the countries of the world are signatories to this initiative. Today we will be discussing safe motherhood, its pillars, and we will then individually discuss all the pillars or components of safe motherhood. So let's start. We know that the goal of Safe Motherhood initiative is to improve the well-being of mothers through a comprehensive approach of providing preventive, promotive, curative, and rehabilitative health care. So there are four pillars of safe motherhood. The building of a safe motherhood initiative is dependent upon four pillars, which may also be called the components of safe motherhood. And these four pillars or components are family planning, first of all. Then there is antenatal care. Then there is clean and safe delivery, and finally essential obstetric care. And all these are based upon the principle of equity for women. And these services, these four components or pillars, the services related to these are provided through primary health care. So we will discuss individually these four components. We will start with the antenatal care. So what is antenatal care? Antenatal care is the care of the women during pregnancy. The care which is provided or which has to be provided to the women during the period of her pregnancy is called antenatal care. It is also sometimes referred to as prenatal care or prepartum care, but the more widely used term is the antenatal care. What are we trying to achieve by providing antenatal care? The main aim is to achieve at the end of the pregnancy a healthy mother and a healthy baby. What we are wishing to achieve is that after the pregnancy ends, it must end with a healthy mother and a healthy baby, and no health problems should be arising at the end of the pregnancy if proper antenatal care is provided. So when should it begin? It should ideally begin soon after the conception, and it must continue throughout the pregnancy. We have talked about the aim of antenatal care, which is to achieve at the end of the pregnancy a healthy mother and a healthy baby. Now, what are the specific objectives of antenatal care? If somebody asks you about objectives of antenatal care, you must enumerate these things, the following things. First of all, the objective of the antenatal care is to promote, protect, and maintain the health of the mother during pregnancy. Throughout the period of pregnancy, a mother should be healthy in each and every way. And to protect and promote and maintain that is the first objective of antenatal care. Second is through antenatal care, you want to detect high risk cases. Uh, you will study later on. There are certain cases or there are certain pregnancies which are deemed or which are considered as high risk. The eventuality of those pregnancies may end up uh, in a non-healthy situation for either the mother or the baby, and those are high risk pregnancies or high risk cases. The second objective of antenatal care is to detect those high risk cases and provide them adequate appropriate care so that at the end of the pregnancy there are healthy mother and baby. The third objective is to foresee complications and prevent them. Again, it is related to the high risk cases as well as non high risk cases. The complications may arise either way. So, what you want to achieve is, what you wish to do is to foresee these, to predict these complications, to know them beforehand so you can prepare for them. And if you can detect them earlier, you can uh, achieve a healthy mother and healthy baby eventually. And also, if you can foresee complications, you can prevent them from happening. The fourth objective is to remove the anxiety and fear associated with delivery. This is a natural thing. Obviously, the woman who has to go through childbirth at the end of the pregnancy has a lot of anxiety and fear associated with it. You wish to remove that anxiety and fear or dread. This is one of the objectives of antenatal care. The next is to reduce maternal and infant mortality and morbidity. We know that the main aim is to achieve a healthy mother and baby at the end of the pregnancy. So obviously, you want to reduce maternal and infant mortality. And we know that infant and maternal mortality is relatively high in our country. So if you can provide proper antenatal care, you can help in reducing maternal and infant mortality as well as morbidity. Next objective of the antenatal care is to teach the mother elements of child care, nutrition, personal hygiene, and environmental sanitation. You want to, through antenatal care, which is provided through the primary healthcare services, you want to educate the mother, to teach her about the child care, how to raise her child, how to provide him or her with proper nutrition. You want to teach her about the benefits of breastfeeding. You want to teach her about the uh, micronutrients and macronutrients. You want to teach her about her personal hygiene as well as her child's hygiene, so that we can reduce the incidence of many childhood diseases, for example diarrhea, etc. And also you want to teach her about the environmental sanitation, how to keep her surroundings clean, so that she herself and her child can remain healthy. The next objective is to sensitize the mother to the need for family planning, including advice to cases seeking medical termination of pregnancy. This period of this antenatal period, the period of pregnancy, is a very good time to sensitize the mother and educate her about the need and benefits of family planning. So this is one of the objectives of antenatal care. When she is going through pregnancy, that is one of the opportune times when you can tell her about the benefits of family planning, proper spacing of children, not having unwanted pregnancies, etc. So this is one of the objectives. The last one is to attend the under fives accompanying the mother. We have earlier discussed in maternal and child health heading that mother and her child are dealt as one unit, since all or almost all aspects of their lives are interconnected, and the child is dependent upon mother for many things, uh, and they are almost always together unless the child achieves an age of over 5. The child is usually with her mother. And one of the objectives of antenatal care is to provide care and to deal with the problems of children of under 5 years of age, which accompany their mother to the antenatal clinics or wherever the antenatal care is provided. So that is one of the objectives of antenatal care. So we have said that antenatal care is the care provided to women during their pregnancy, and there are certain things, certain objectives that we want to achieve by providing this antenatal care. And we have talked about those objectives, and the main aim is to achieve a healthy baby and a healthy mother at the end of the pregnancy. Now, how can this antenatal care be provided? Obviously, the mother will have to visit the healthcare facility for this antenatal care. There are other ways it can be provided at the doorstep as well, but the main way is by the mother visiting the antenatal care facility. अच्छा जी, when should she visit, or how many times should she visit, or how many visits should there be? So ideally, the expectant mother should attend antenatal clinic once a month during the first 7 months of pregnancy, then twice a month during 8 months of pregnancy, and then once a week after the 8th month of pregnancy. This is the ideal situation. This is the ideal way for antenatal care to be provided. Okay, जो visits हैं during the first 7 months, there should be one every month. उसके बाद 8वें months में there should be two in the 8th month or bi-weekly, and then after the 8th month there should be a weekly visit. But this is only ideal situation. What is the minimum target or yeah, minimum requirement of visits, antenatal visits? So there is a recommendation by the health organization of 4 visits during entirety of pregnancy. Okay, at least on the minimum there should be 4 visits throughout the pregnancy. We know ideally there should be more, but obviously that is not achievable, especially in our part of the world. What should be the minimum target? That is 4 visits during the entirety of the pregnancy. And when should these 4 visits be? The first visit is within 12 weeks after uh, after the conception, yeah, preferably as soon as pregnancy is suspected. Then second visit is between 14 to 26 weeks of pregnancy. Third visit is between 28 to 34th weeks of pregnancy. Fourth visit is between 36 weeks and term. So what is done during these antenatal visits? The antenatal checkup is done. This antenatal checkup and some other things. This antenatal checkup involves many things. There is history taking of the subject or the patient or the pregnant lady who is visiting you for the antenatal care. There is physical examination. There is abdominal examination. Gestational age is measured, or then there are some lab investigations which are ordered during the very first visit for the antenatal care. Then there are things like maintenance of records, the whole record of her visits and her situation and her history, examination, everything is recorded, and that record is maintained not only at the health facility, that record is given to the pregnant lady, so that if she visits some other facility for her second visit or third visit or subsequent visit, she has the record of her previous visit with her. Then some home visits can be arranged. We know about the lady health visitors and lady health workers. Lady health workers can visit the houses of these ladies. Specific health protection, we will know about it, we will discuss it later. Family planning advice is provided. The at risk cases are identified. Prenatal advice about nutrition and specific advice about diet, etc., hygiene is provided. Mentally prepared the patient for her delivery. Then there is a pediatric component, as we have discussed. Antenatal care also involves attending to the under 5 children which accompany the mother. As we have talked about earlier, there are certain things that are done during every antenatal visit. So every antenatal checkup or every antenatal care visit involves certain things. There are things which are additional to the first visit, but then from then on, in each every subsequent visit, there are certain things which are done. So what are these things? On the first visit, patient's history is taken. Uh, this is routine gynecological and obstetric history. You will study about that in your gynae and obs lectures. Then you conduct a physical examination. This physical examination involves the recording of the weight, the blood pressure, pallor, which may indicate or which may give you an idea about the anemic status of the lady. Or then there are other measurements. Respiratory rate is seen. Edema. The edema and blood pressure are important since you want to identify the patients which may go on to develop pregnancy-induced hypertension or eclampsia, as you know. So these are essential components in a physical examination or general physical examination, which are done at every antenatal checkup. Then third is you conduct abdominal examination. You know that abdominal examination in obstetrics is important. You can know about the fetal lie. You hear the heart sounds, the fetal heart sounds. You have to conduct the abdominal examination at these checkups. It also involves the measuring of fundal height. The fourth thing is you order some lab investigations. Uh, there are some baseline investigations which you have to do in every case. Then there are some investigations which you may order if you feel it necessary. So these are some of the things, very briefly, which are carried out at every antenatal checkup. Obviously, at her first visit to the antenatal care facility, you will do the confirmation of pregnancy. Usually, it is done during the first trimester by urine test using a pregnancy detection kit. You know about the presence of hormones in the urine during pregnancy. Those are detected by this kit, and pregnancy is confirmed. Why is early detection important? If you can detect pregnancy early, you can plan adequate care for mother and fetus, and you can record the date of last menstrual period and calculate the expected date of delivery. You can assess mother's health status and record baseline information, and you can timely detect the or foresee the complications and plan their management. Also, you can establish a good interpersonal relationship between caregiver and pregnant woman. So these are the things for which an early detection of pregnancy is very important.